What if the most dangerous cancer you've never thought about has already been sending you signals for months? Here's a number that should stop you cold. 11%. That's the 5-year survival rate for pancreatic cancer. Not because it's impossible to survive, but because by the time most people get diagnosed, it's already too late for the options that matter most. Every year, over 60,000 Americans receive this diagnosis, and studies confirm that 3 out of 4 patients had symptoms for months before anyone connected the dots. Months of signals ignored. Why does this keep happening? Because pancreatic cancer is a master of disguise. Your pancreas, roughly the size of your hand, is buried deep in your abdomen, shielded from easy examination, producing the enzymes and hormones that quietly keep your entire body running. You never feel it working, which means you almost never feel it when something goes wrong. Until the signals get loud enough to demand attention. Today, we're handing you a decoder. 7 specific body signals your pancreas uses when it's in crisis, including the ones so ordinary looking that most people spend weeks, sometimes months, brushing them aside. Number 4 especially. That one surprises everyone. And here's something recent research from Johns Hopkins uncovered that you need to hear. Identifying just 3 of these signals together increases the odds of early detection by 68%. That's not a small number. That's the difference between options and no options. Quick note, everything in this video is for educational purposes only. It is not medical advice. Always consult a qualified healthcare professional about any health concerns. Source links are in the description. If this is the kind of content that could genuinely save a life, yours or someone you love, hit like right now and subscribe. Let's get into it. Signal Phase 1, your urine is trying to tell you something dark. Most people would never think to look at what's in the toilet as a potential cancer warning. Which is exactly why this signal gets missed so consistently. When a pancreatic tumor begins growing, one of its most common early impacts is on the bile duct, the narrow channel that carries bile from your liver into your small intestine. When that duct gets compressed or blocked, a compound called bilirubin, normally flushed out through your stool, starts accumulating in your bloodstream instead, and your body, desperate to offload it, starts pushing it out through your urine. The result? Urine that shifts from its normal pale yellow toward a deep amber, the color of strong brewed tea or cola. Not just first thing in the morning, not just when you haven't had enough water. Consistently dark, even when you're well hydrated, even after drinking a full glass of water. Still dark. Here's what makes this signal so medically significant. This urine discoloration frequently appears before the more visible signs of jaundice, before your skin yellows, before the whites of your eyes shift. It's an earlier alarm, and it's one most people dismiss for days or weeks as dehydration. The rule is simple. If your urine remains consistently dark for more than a few days despite adequate hydration, that's not a hydration issue. That's a conversation with your doctor today. Signal Phase 2, a pain that lies between your stomach and your back. Pain is your body's most ancient language. But pancreatic pain speaks in a dialect most people don't recognize, which is why it so often gets misread as a muscle strain, a digestive problem, or just stress. Here's what makes pancreatic cancer pain distinctive. It doesn't live in one place. It radiates, typically originating as a dull, deep ache in the upper abdomen, not sharp, not fleeting, but persistent, and then extending backward, creating what patients often describe as a band of pressure wrapping around the torso, front to back, steady and gnawing. 2 specific patterns raise immediate flags for physicians. First, the pain worsens after eating. When you eat, your pancreas is called upon to produce digestive enzymes, and if a tumor is present, that activation increases pressure and pain. Second, the pain intensifies when lying flat but offers some relief when leaning forward. That postural shift is neurologically telling. Early on, this pain comes and goes. There are good days, and those good days are part of what makes this so dangerous, because the good days become reasons not to investigate. If you've been explaining away a persistent upper abdominal aches that seems to echo into your back, especially one that responds to meals or body position, please stop explaining it away. That pattern has a name, make sure it's the right one. Signal Phase 3, bloating that antacid simply won't fix. Everyone gets bloated. Gas, a heavy meal, stress, these are universal experiences. Which is precisely why this signal disappears into the noise. But there's a specific quality digestive disruption caused by pancreatic cancer that sets it apart from ordinary digestive discomfort. And once you understand it, it's harder to ignore. Your pancreas is the engine behind digestion. It produces the enzymes that break down fats, proteins, and carbohydrates. When a tumor begins disrupting that enzyme production, or physically pressing against the stomach or small intestine, the digestive system starts to malfunction in ways that are persistent, progressive, and resistant to normal remedies. Antacids don't touch it. Dietary adjustments don't fix it. Gas relief medication provides no real relief. You might feel abnormally full after just a few bites, a clinical phenomenon called early satiety. Your abdomen might feel tight and swollen through the day, not just after eating. Nausea that arrives without an obvious trigger. A vague, constant sense of digestive wrongness. The key word throughout all of this is persistent. One uncomfortable week after a poor diet is noise. Weeks of consistent bloating and digestive disruption that doesn't respond to anything. That's a signal. Treat it like one. Signal phase 4, your gallbladder is swelling. This is the one that surprises people most. Not because it's the most dramatic symptom, but because of what's actually happening beneath the surface while you feel nothing unusual at all. When a pancreatic tumor grows near or presses against the bile duct, bile begins backing up into the system. Your gallbladder, normally the size of a small pear, fills up and has nowhere to drain. It enlarges quietly. Without dramatic pain, without an obvious announcement, your liver can begin swelling too as bile accumulates within its tissue. This hepatic enlargement sometimes presents as a firmness or fullness beneath the right rib cage, detectable during a physical examination by a physician, but rarely something a person notices on their own. This is why routine physical examinations matter more than most people realize. A doctor pressing carefully along the right upper abdomen during a checkup can sometimes detect enlargement that the patient had no awareness of at all. Modern imaging, ultrasound, CT scan can reveal these changes clearly. The real challenge is that this signal is nearly impossible to self-detect, which means the gateway isn't awareness of this symptom alone. It's using awareness of your other symptoms to get into a doctor's office where this one can be found. These organs are speaking. The conversation just requires a trained ear to hear it. Signal 85, blood clots in places that don't make sense. Of all the signals on this list, this one creates the most confusion because it seems to have nothing to do with the pancreas at all. But here's the biology. Pancreatic cancer releases inflammatory substances into the bloodstream. These compounds, including tissue factors and pro-coagulant proteins, throw your body's clotting mechanisms into a state of hyperactivity. Blood clots more easily than it should, and those clots tend to form in the deep veins, most commonly in the legs. Deep vein thrombosis, or DVT, presents as swelling, warmth, tenderness, and redness, usually in one leg, seemingly without cause. No injury, no long flight, no obvious explanation, just a leg that's swollen, sore, and warm to the touch. The stakes escalate dramatically if a piece of that clot breaks free and travels to the lungs, a pulmonary embolism. Sudden breathlessness. Chest pain that sharpens with deep breathing, a racing heart. These are emergencies. They require immediate medical attention, no delay, no waiting to see if it resolves. Here's the critical awareness point. In a meaningful percentage of pancreatic cancer cases, a DVT event is actually the first sign that leads to diagnosis. Something that seemed to have nothing to do with the pancreas turns out to be the body's loudest early distress call. An unexplained blood clot is never just an inconvenience. It's always an investigation. Signal phase 6, fevers that come and go without explanation, not the fever of a clear infection, not the predictable progression of flu. Something stranger and more persistent. When pancreatic cancer triggers inflammation around the pancreas and bile duct, your immune system responds. But because this isn't a standard infection following a standard course, the fever it produces has a distinctive pattern, episodic and recurring. Spikes of high temperature, episodes of intense chills and shivering, followed by periods that feel more normal. Then the cycle repeats. Night sweats often accompany these temperature fluctuations. A general sense of feeling deeply unwell that doesn't resolve the way a viral illness resolves. The specific danger of this signal is how convincingly it mimics other things, a recurring low-grade infection, hormonal changes, an immune system quirk. Patients and sometimes even physicians spend valuable time investigating those more common explanations while the actual driver continues undetected. What differentiates this from a standard illness fever is the timeline. A typical viral fever is self-limiting, 1 week, resolved. Pancreatic-related fever recurs. It comes back. It doesn't follow the normal resolution curve. A fever that keeps returning without a clear infectious explanation deserves a thorough, systematic investigation, not a wait and see approach. A thorough one. Signal phase 7, a fatigue that sleep cannot fix. There is tired. And then there is this, cancer-related fatigue, particularly associated with pancreatic cancer, operates on a different physiological level than normal exhaustion. It doesn't follow the basic equation of effort followed by rest followed by recovery. You sleep a full night and wake up depleted. You rest through an afternoon and feel no better for it. The exhaustion is present at the start of the day and remains through its end. What's happening biologically is this. Cancer cells are metabolically aggressive. They compete directly with healthy cells for glucose and nutrients. Your body is simultaneously fighting an inflammatory cascade, potentially managing bile obstruction, running a disrupted digestive system, all while being nutritionally compromised because poor appetite and malabsorption have reduced what it has to work with. The result is a total energy system running on near empty. Even light physical tasks, climbing stairs, carrying bags from the car, can feel genuinely effortful in a way that doesn't match any prior version of yourself. There's an emotional dimension too. This level of physical depletion is deeply disorienting. Anxiety and depression are common companions to cancer-related fatigue, and they further disrupt sleep, creating a cycle that compounds the physical symptom. The key differentiation from ordinary life fatigue is persistence and scale. This exhaustion doesn't respond to the things that should work. It exceeds what the circumstances seem to explain. It's new, it's different, and it has been building. When fatigue begins feeling fundamentally unlike anything that came before it. That is a signal worth taking seriously. What you do next is everything. 7 signals. Each one individually explainable away. Each one in combination with others, part of a pattern that medicine can act on if caught in time. The 11% survival statistic is not the whole story, because buried inside that number are the patients who were caught early, whose signals were recognized, investigated, and acted upon while options still existed. Their outcomes look profoundly different. This is what early detection actually means in practice. It's not a vague medical concept. It's the difference between a conversation with your doctor in October and a diagnosis with no good options in January. If you recognize something in this video, a symptom you've been explaining away, a pattern that sounds uncomfortably familiar for yourself or someone you love, please don't sit with that feeling. Book the appointment. Ask the question. Push for the investigation. You don't need certainty to ask for clarity. You just need to ask. If this video gave you information that matters, please like it. That single action helps us reach the next person who needs this before it's too late. Subscribe so you never miss content that could change outcomes. And check the videos on screen right now. We've put more together that continues what we started here. Share this one. You may never know whose life you changed by doing it. Take care of yourself and take care of the people around you.